Prescription drug prices are now so high that 1 in 4 Coloradans didn't fill a prescription last year because it cost too much. Well, now Congress is stepping in, and a Colorado representative is leading the way with the Freedom from Price Gouging Act. Our political specialist Sean Boyd live at Capitol Heights Pharmacy in Denver. Sean, a lot of people impacted by this.
Yeah, and Jim, especially seniors whose copays are often more than their income. Americans spend more money on prescription drugs than anyone in the world, in large part because there is nothing to stop drug companies from raising prices as high as they want. The issue has now reached a tipping point, and Colorado Congressman Jason Crow has a bill that would impose hefty penalties on companies that engage in price gouging.
I can't really use my left leg. I walk with an electronic walking aid.
Claudia Curry-Hill was diagnosed with multiple sclerosis in 1988. It would be years before a drug came to market that slowed the progression of her disease. It costs $400 a month with insurance. When she went on Medicare, it went from $400 to $4,000 a month.
I had to go off medication because we just couldn't afford it. We're retired. My husband actually offered to keep working. He was 75 at the time.
The wholesale price of the drug she was taking, Gilenya, increased nearly 60% in just 5 years to almost $100,000 a year. Curry-Hill says that's greed.
There's no reason for it to be this high. Every MS drug that's on the market today, the National Institute of Health has sponsored or paid for. And who pays for the NIH? It's our taxpayers.
Drug prices keep on going up and up and up.
Congressman Jason Crow plans to put a stop to it. He's a lead sponsor of a bill that caps price increases for Medicare patients to the cost of inflation. If a drug company raises prices beyond that, it has to reimburse customers the profit and could face a penalty equal to 125% of the increase. Medicaid already does it, and Crow says it's working.
What this bill does is it says enough is enough. We're going to stop these vast increases in drug prices because Americans are paying far more than the rest of the world.
It is too late for me. I'm already off the drugs. But there's a lot of people right behind me that need the help. You know, I'm still standing, and that's good.
And Congress may actually take action on this one. A similar bill in the Senate has the support of both Democrats and some Republicans. Crow is also sponsoring a bill that would allow Medicare to negotiate drug prices. Live in Denver, Sean Boyd covering Colorado First.
Step in the right direction. Thanks, Sean.